Well, the XBB.1.5 Covid variant, nicknamed the Kraken, has triggered concern about how quickly it can spread. But as you've been hearing there, so far there don't seem to be significant differences in the severity of its effects as compared to other variants. To discuss what it means and what to do about it, I'm joined by Dr Richard Lessells, who is an infectious diseases specialist at UKZN. Richard, good evening to you. Welcome to our program and thank you for your time. Share with us what our scientists are learning about this variant and what its symptoms are.
Sure. I mean, really, this was something that was getting a lot of international attention because it's increasing as a share of the infections in some parts of the United States and some parts of Europe. So there was a lot of international attention about XBB.1.5. The reality is, in South Africa, this is not something that we need to worry about at the moment, or certainly to change anything that we're doing at the moment, any of the public health measures that we're taking against this virus. This is still part of the Omicron family. As you say, Omicron, this virus is already highly transmissible. It spreads very efficiently between us, between person to person. Whether this particular subvariant XBB.1.5 does that slightly better than other subvariants, it's really of no material difference in terms of how we approach this virus. It's a virus that spreads very easily. It's a virus that can make people sick still, and that's why the primary public health measure at the moment is to ensure that people are up to date with their vaccinations, and particularly the people that are at higher risk of getting unwell with this virus.
I'm glad you talked about, the vaccinated population versus those who aren't, vaccinated and boosted population versus those who aren't. When we think about South Africa and the number of people in terms of the proportion of the population who've opted to get vaccinated and boosted, in these months since we first started that rollout campaign, this universe of, infection and cross-infection, developing herd immunity, where do we stand on that as an insulation against a variant like this? And would those who are not vaccinated be way more vulnerable and at risk?
To some extent, but I think you made the point there well that the unvaccinated group in the population have been infected with this virus, and many people have been infected now more than once, have been infected twice, 3 times, maybe more than that. And most of us in South Africa will have been infected with some form of Omicron over the past year. And so what that means is that kind of immunity that we each have individually and that we have across our communities is protecting many of us from the most severe effects of this virus infection, from landing in hospital, from needing oxygen, from needing the ventilator. And that's clearly a good thing. Of course, what we want to try and ensure is that those that are still at the highest risk of becoming very unwell, that their immunity is kept at a level that gives them that protection. And that means periodically getting another vaccine dose to top up that level of immunity and make sure that if they are going to get the virus again, then they don't get those severe consequences of the infection.
Just a quick one before we look at what's happening in other countries, and I understand that you've just come back from the US where some cases have been discovered there as well. Should we just go back to mask wearing as a precaution? Would you advocate that, or shall we just keep things as they are?
I don't think there's any role for that as a public health measure across the population. You are aware that about a year ago, we kind of stepped down those measures that were trying to prevent the spread of the virus. And we've really focused in this past year on protecting the most vulnerable from the severe illness. And that's the right strategy. And it continues to be the right strategy, despite what we see with these appearance of new subvariants and the alarm that's created about that. It is still the right strategy to focus on preventing people getting very sick with this virus. This virus will continue to circulate, will continue to evolve. We'll see kind of peaks and troughs in the number of infections, in the level of transmission in our communities. But we can accept that if we can maintain protection of those most vulnerable people in our communities.
As has been widely reported, this variant become the dominant strain in the US. It's also been detected in dozens of other countries, according to the World Health Organization, still yet to be identified in China. But I guess what I want to ask you is, you know, we should perhaps evolve our expectations, right? It's inevitable that we're going to see different strains showing up in other countries, and the inclination perhaps should be less towards panic and more towards almost becoming not comfortable, but almost expecting that we are going to see different strains and variants. And in answering that question, maybe just share, you've just come back from the UK. They've got some cases they detected there. How are they responding?
Yeah, I mean, you're completely right. We have to completely reset our expectation. We have to understand we are in a different phase of the pandemic here. And I think you said yourself, I mean, that's not universal in every country. So South Africa is in a different state than some other countries. And we look at what's happening in China at the moment. But within South Africa, we have to understand where we are. We're going to see new subvariants, variants emerge as the virus just continues to spread in South Africa and around the world. That doesn't have to mean the same as what we saw in the first 2 years of the pandemic, that drives a big wave of infections and sends many people to hospital. It may not be the reality going forward. We have to understand that this will happen, but it will not translate to the same level of people getting very, very sick and putting pressure on the health system. But we all have a responsibility within that. If we are in those groups where we're at risk of getting unwell with this virus, then our responsibility is to be up to date with vaccinations so that we are protecting ourselves and protecting the health system. And as you say, I just came back from the UK and actually I acquired COVID in the UK last week, and that was the first time that I'd had COVID, and I knew it was quite likely to happen as I was mixing with family and friends back in the UK, enjoying the snow in Scotland, and got COVID. And who knows, maybe I was infected with this subvariant of Omicron. It doesn't matter, because I've had 3 doses of the vaccine, was well protected, felt unwell for 2 days, and I'm now feeling better.
Yeah, Dr. Richard Lessells, thank you for sharing that with us and your status, and we wish you a full recovery as well. Dr. Richard Lessells, who is an infectious diseases specialist at UKZN, just reflecting on the public health response to this new COVID-19 variant.